Well, adults around here have been getting their first or second, their booster shots now, several weeks in Onondaga County, but the new cases just don't seem to be letting up.
Upstate Global Health Director Dr. Stephen Thomas is here to give us some more insight. Dr. Thomas, so good to see you. Thank you for joining us tonight.
It's my pleasure.
Dr. Thomas, let's start here. We do see more people getting their booster shots, but how long does it really take to, well, boost up your immunity?
Yeah, I mean, within a few days of getting vaccinated, your body's going to start kind of churning out more antibody. And then as time goes on, probably around a couple of weeks, maybe 2 to 3 weeks is probably when you're reaching your peak. And it's not just antibodies. That's what we talk about the most, but it's all forms of immunity that our body's able to create. So it happens quickly.
Another question for you, with more people getting booster shots, more vaccinations, kids now starting to get vaccinated. What should we be doing in terms of masks and indoor gatherings and other COVID protocols, especially as we move indoors? A lot more now. Cases still seem to be so high.
Yeah, well, moving indoors, as you imply, it's a higher risk situation than what we've had over the summer, right, where people can kind of are naturally distanced from one another. They're outside. The ventilation is much better. So it is a higher risk scenario. Yes, more people are getting vaccinated. That's true. But unfortunately, we still have a significant percent of the United States and even our county that are not vaccinated. And so the risk still remains. So I think that we should continue to stay the course in terms of wearing masks when you're going indoors, especially into crowded environments. And if you are someone that's at risk of having a bad outcome if you get infected, I would really keep that mask on. And certainly if you're not vaccinated, you should really think about getting vaccinated. And if not, then you need to be wearing that mask pretty much everywhere.
We know there are breakthrough cases. We knew that there would be. Nothing was 100% with these vaccines. But since they tend to be a little bit more mild, how do you know? I mean, are there symptoms that are different for a breakthrough case versus somebody who's unvaccinated and gets COVID? Is there anything to read? How do you figure this out?
Yeah, well, the majority of the people who are ending up in the hospital and the majority of the people who get severe disease and unfortunately die are unvaccinated people. So even though we're seeing breakthrough cases, they still make up a very small percentage of all the cases that end up in the hospital or end up with people passing away. So that's a good thing. And it's true that once you get vaccinated, not only are you protected from those bad outcomes, but it can make the disease less severe. Now, I will say that even people who get mild COVID have the potential for having what we call long hauler syndrome or long COVID. So I don't want to minimize people having mild disease, because it can still be very uncomfortable, but it is certainly more desirable to have that than to end up in the hospital on a ventilator and fighting for your life.
We're eager for you to dive into this one. mRNA, that's the technology Pfizer and Moderna are using to deliver the COVID-19 vaccine. What are the possibilities now with other vaccines and treatments and cures for other diseases?
Yeah, so COVID is the vaccine that was built on 30 years of other work, right? So there have been other vaccines tested using this technology. So Ebola, HIV, influenza, Zika, for example. So COVID just was kind of the unfortunate alignment of planets that allowed this technology to really demonstrate what it could do. But the technology is already being used to look at to make vaccines against other diseases. Matter of fact, we are working with Pfizer at Upstate testing an influenza vaccine. We're actively enrolling volunteers in that trial right now. So it's already underway, and really the sky is the limit. And people are hoping that because this technology is so flexible and can pivot, that maybe some of these harder diseases that we have not been able to make vaccines for, we might actually have a shot now.
Sky's the limit.
Yeah, that's great news. Happy to hear that. Will there be a point as far as COVID-19 where everyone else, I mean, there's a selection of the population that's not eligible for boosters right now, but that everyone's going to need another shot?
Yeah, I really don't know the answer to that, because we have to do the studies, right? This is why the studies are up to 2 years and sometimes longer in duration, is because we have to be able to measure all these immune responses and all these different people over time. I expect that people that have underlying medical conditions, they are going to always be offered at least a 3-shot series, so the first 2 shots within a month, and then anywhere from 6 to 12 months after that getting a 3rd shot. But I don't know if everyone is going to need a 3rd shot, because remember, this vaccine, even 2 shots are very, very good at protecting people from severe disease, hospitalization, and death. So I think what the CDC has decided right now in terms of who is eligible and who is not, I think that that's the right play right now until we get more data from these long-term studies.
All right, Dr. Stephen Thomas, I hope you know how much we appreciate you. Thank you so much for joining us again tonight.
Thanks for having me.